السلام عليكم، يعطيكم العافية. أنا الدكتور ضياء سويدات، أخصائي الطب النووي والعلاج بالنظائر المشعة. حالة اليوم هي a non-case of Hodgkin lymphoma, stage 4 Hodgkin lymphoma with lymphadenopathies above and below the diaphragm and lung involvement, spleen, liver, and bone marrow involvement. The below one is the previous one, is the baseline staging PET scan, and the above one is the interim PET scan after 2 cycles of ABVD. ABVD is a regimen used to treat Hodgkin lymphoma. This case have a complete metabolic response to therapy after only 2 cycles. Let's see the head and neck regions. This is diffuse brain activity, this is physiological activity, and this is streaking artifacts in the dental regions. No evidence of hypermetabolic lymph nodes in the cervical region in the baseline or in the follow-up in the interim scan. This is the inferior one. There are hypermetabolic lymphadenopathies in the left axillary. They are matted lymph nodes in the left axillary region, in the prevascular mediastinal region, subcarinal and left hilar. There is left pleural involvement and left lung involvement as well. All of them are completely resolved on the interim scan, the above one. Here in the left axillary region, there is complete metabolic response with significant morphologic regression in the previous hypermetabolic left axillary region, and the current one measuring about 2.2 centimeter in largest axial dimension with SUV max around 1.8. In lymphoma assessment, especially high grade lymphomas, we compare the activity with the liver, something called Duval score. Duval score divided into 5 score, 1, 2, 3, 4, 5. 3 and 2 and 1 called complete metabolic response. Duval 3 less than or equal to the liver activity. Duval 2 less than or equal to the mediastinal, and Duval 1 no uptake. This is activity. This SUV max 1.8. When we compare it to the liver, it will be around 2.9, around 3. And we should measure the mediastinal activity. It's 1.3, and the axillary region is 1.8. So it's more than the mediastinal and less than the liver. This is Duval 3. It's still complete metabolic response. Duval 4 and 5 depends on the baseline. If it increased more than the liver, slightly more than the liver, this is Duval 4. If it's 2 or 3 times above the liver, it's Duval 5. However, we called it regression or stable or progression depending on the previous scan. If the previous scan, for example, the SUV max was 20 and the current SUV max is 10, this is still Duval 5, however, it's partial response. If the Duval score in the staging was 20 and still 20, it's Duval 5 and it's stable. If the previous scan SUV max 20 and now it's 40, it's Duval 5 and it's progression. So Duval 4 and 5 depend on the previous and the staging PET-CT scan. Okay. However, here the SUV max 1.8, it's less than the liver. Normal breast tissues, no evidence of active focal lesions in the breast. This is normal physiological activity in the heart. Let's see the lungs. And of course, as we see, the resolution of the image is somehow low, which is attributed to many factors. The first one is maybe lower dose of FDG given to the patient. Second one is the long interval between the injection and the imaging time, which because the half-life of the FDG is around 110 minutes. So if we delay the imaging of the patient, most of the radio tracer will go away from the patient and the image resolution will be somehow bad. So as we see, these are not foci. This is heterogeneous due to low resolution. It's absolutely normal activity. We can see by, maybe this is clear and obvious. This one. This is more clear. The liver is normal. The previous scan have activity in the liver and activity and multiple foci in the spleen, the inferior one here. This is the previous one. Multiple splenic foci, upper abdominal region, upper abdominal lymph nodes, and liver lesion, and all of them completely resolved on the interim scan. Both kidneys are normal. The prostate is normal, gallbladder is normal. So let's go to the musculoskeletal system. In the previous scan, the staging process, there are multiple bone and bone marrow lesions, like here and here, vertebrae, ribs, and left condyle of the mandible. All of them on the follow-up here, in the follow-up scan, the interim scan, the superior image, all of them resolved. And there is complete metabolic resolution of the previous multiple bone and bone marrow lesions involving the ribs, the vertebrae, multiple bilateral pelvic bones, and right proximal femur. Let's see this is the right proximal femur, and it's on the follow-up, it's completely resolved. So this is a case of complete resolution. There is diffuse bone marrow activity in the bone marrow. It's likely due to recent chemotherapy, and it's likely reactive in nature. And this is our scan. It's follow-up evaluation of Hodgkin lymphoma post ABVD. The brain is normal. Head and neck regions are normal. This is the chest. Complete resolution of the previous hypermetabolic thoracic lymph nodes involving blah blah blah, with current smaller nodes of non-significant. We should write the SUV max of the most prominent one to compare it with the liver, as we say it's 1.6 or it's 1.8, and the liver SUV max around 3. The mediastinal, we should write it in the chest. Mediastinal blood pool SUV max around 2.3, and we should write the liver SUV max here. We should write in with the sentence of the liver and with current normal physiological liver FDG activity SUV max around 3. In the abdomen and pelvis, complete resolution of the previous hypermetabolic splenic foci, complete metabolic resolution of the previous upper abdominal and the liver region, the liver lesion, as well as complete resolution of the previous hypermetabolic multiple bone and bone marrow lesion. All the other sentences are from the template, they are normal. And this is our conclusion. Complete resolution of the previous hypermetabolic lymphomatous disease within lymph node groups in both sides of the diaphragm, spleen, liver, left lung, and pleura, as well as bone and bone marrow, and no interval development. We should write this sentence. Complete resolution of the previous diseased site and no interval development of hypermetabolic concerning lymphomatous lesions. And this is our impression, consistent with complete metabolic response, Duvel score 3. Thank you, and see you in the next cases.